Welcome to this segment of our learning series on health equity basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. This segment will cover the idea of bias and how it affects health equity. Bias is prejudice in favor of or against one thing, person, or group compared with another. Everyone has some level of bias, some that we are aware of and some that we are not. When working to advance health equity, knowing and addressing our biases will help us identify and promote fair and unprejudiced behavior and practices. Stereotypes are generalizations about a group or individual based on our assumptions. Bias is when we act on these assumptions even when they are not supported by fact or evidence. Implicit bias, sometimes called implicit prejudice or attitudes, are a collection of associations that emerge upon encountering an individual or group. It happens automatically or unconsciously, and they are formed over our lifetime. They can lead us to associating negative or positive stereotypes with certain groups, and this can affect how we interact with them, the decisions we make, and how we treat them. Implicit biases are unconscious and can be either positive or negative. They are formed over a lifetime and can be changed. An example of an implicit bias is when most people hear the word kindergarten teacher, they are more likely to picture a female. This can happen without intention or awareness and may even contradict openly held beliefs. With explicit bias, we are aware of our prejudices and our attitudes. Explicit biases are developed based on the environments where we were raised, the people around us, and what was considered explicitly acceptable or unacceptable. Expressions of explicit bias occur as a result of deliberate thought and can be consciously regulated. The biggest difference between implicit and explicit bias is that we are fully aware of our explicit bias, where implicit biases may occur unconsciously. With explicit bias, we are conscious of our thoughts and choose our actions. With implicit bias, we can work to become aware of them and change our behaviors as a result. Here are some examples of different bias categories. These biases can be either implicit or explicit. Bias can influence actions that might be discriminatory or unfair. It is important to understand bias as a concept, but also to do self-reflection work that uncovers our own personal biases and learn to develop counter behaviors. Confirmation bias means actively seeking information to validate our opinion or beliefs. This can lead to selective observation and us not seeing or valuing evidence that contradicts our beliefs. Halo bias or horn effect is when one's perception of another's action is unduly influenced, either positively or negatively, by an unrelated trait or first impression. The halo effect can introduce bias into decision-making when you focus solely on one great feature about an individual and ignore everything else. Conformity bias means having a very strong tendency to go with the group or succumb to peer pressure. Ableism bias is treating or thinking of people differently because of their disability or perceived disability. Like other biases, ableism bias may be implicit or explicit. Affinity bias is when we prefer people who share similar qualities to ourselves. Gender bias, as the term suggests, occurs when actions or decisions are based on gender, often stereotypes and deep-seated beliefs about gender roles. A microaggression is a subtle, indirect, or sometimes unintentional act of discrimination. Often when we commit microaggressions, we don't realize that they were generated by our implicit biases. An example is helping a person in a wheelchair get an item off the shelf without being asked, assuming that they need help. Microaggressions are not always intentional, but it's important to be aware of the impact they can have on those around us and how they can impact our relationships and treatment of others, and to work to better understand why they happen and how we can change our behavior to eliminate them. Our actions and what we do with our biases are what determines if prejudice is taking place. Keep in mind that everyone has some form of bias. There are strategies to break the link between bias and behavior. We can explore our own prejudice by taking the implicit association test available through Harvard University. We can break the link between bias and behavior through self-reflection and getting to know the people with whom we have a bias towards. We can evaluate people based on their personal characteristics rather than those affiliated with their group. We can learn to slow down, pause, and reflect on our potential biases before interacting with people. We can frame uncomfortable conversations around a learning perspective, and we can create a safe space for conversation about bias and how they affect our lives and work. The next segment will review some of the actions that individuals and organizations can take to help advance health equity.